am very excited and grateful to have Dr. Teresa Hilgers with us today. Our audience will be familiar with her father, Dr. Thomas Hilgers, who's been on the show a number of times. Her mom, Sue, who I haven't had on the show, but I wish I would sometime. She's just such a sweetheart. And I had a chance to meet them a year or so ago at a conference, and we had such a good time. Dr. Teresa Hilgers completed her undergraduate studies at Baylor University, her master's from Georgetown, went on to medical school at Creighton University, trained in obstetrics and gynecology at Mercy Hospital in St. Louis. She then completed one-year fellowship in medical and surgical NaPro technology and is now a staff physician at the St. Paul VI Institute, where she actively is involved in the education of the fellows who train at the Institute. Dr. Hilgers, it's so good to be with you. Welcome.
Yeah, thank you so much for having me. It's great to be here.
Well, I asked you to come on to address the effects of contraception, especially oral contraceptives, on women's overall health. But I'd love to begin with a little background on you, your father, the St. Paul VI Institute. You know, your father pioneered the Creighton model, and I don't know if he did that alone, but I know he pioneered the Creighton model to track women's cycles. And that would assist them in both delaying and achieving pregnancy. Do I have that
That's
right?
correct. So he actually developed the Creighton model with three women, my mom,
Okay.
one of them, and then two
Ah,
nurses in St. Louis, Ann Preble and Diane Daly. My parents lived in St. Louis at the time, and they developed this research project. And to keep long story short, they ended up developing the Creighton model through a lot of research, and actually Diane Daly and my mom continue to work with my dad on the Creighton model. Anne Preble sadly passed away from ovarian cancer
uh,
a number of years ago, but she was involved in training Creighton model teachers around the world and would travel even during some of her treatments for cancer. She was traveling the world teaching people. So it was the four of them who developed the Creighton model. And then NaPro technology is the medical science that arose from that, because
yes.
you're right, Creighton model can be used to avoid or achieve pregnancy. It's very effective at both. But my dad's patients would bring their charts to him with gynecologic issues. And he was like, these charts are starting to look the same for different issues. And he realized that the chart was telling him something. And then he developed NaPro technology, which is a health science that utilizes the Creighton model to evaluate medical conditions, come up with the correct diagnosis, and then treat the women's cycles in a way that, or treat the condition that cooperates with the cycle instead of suppressing it. So it's trying to work with the body and all of that. So that's where it all developed, actually.
Yeah. Now you're located in Omaha,
That's correct.
Nebraska,
Mm-hmm.
but your reach goes on way well beyond there. And can you
Mm-hmm.
just touch that on that a little bit? Because
Yeah.
your dad and mom sent me a picture when your dad met John Paul II.
Yeah.
And then he took up this call, right, for
Mm-hmm.
doctors and scientists to come into this field to help people, right?
Right. Right.
To decide on family size, but also to help them with fertility. And I think people forget about that. I'll just let me just say this one thing, Dr. Teresa, is that when I'm speaking on these issues to the
Mm-hmm.
public, so often women will be upset because I'll say, IVF is against, Catholic teaching, etc. And they'll start to cry because they want a baby, right? They want to form a family. It has been incredibly, it's just an incredible blessing to understand NaPro technology, to
Mm-hmm.
meet your dad and your mom, your family, you,
Yeah.
and to be able to bring hope to these people. And I segue that because they don't have to go to just to Omaha, even though I know you're busy there and that's your headquarters.
Mm-hmm.
But there's doctors. I'm in the what I call the belly of the beast here with Illinois. It's just so terrible with life issues.
Mm-hmm.
But there's NAPRO doctors here too, and it's wonderful to be able to say to them, I've got something for you
Right.
to help
Right.
with your fertility. And not only do I have something, but I have something that's going to not just put a band-aid on your issues, but go deeper and actually help you heal, your body heal. And now you're training doctors really all over the world for this.
That's right. So my parents, they started the Pope Paul VI Institute in 1985, but the dream started actually the day they found out that Pope Paul VI passed away. They decided they would
Mm,
build the institute on the day they heard the news at Mass. That's where they heard that he had passed. So anyway, so it's been a long process for them. They developed the institute first, and then NaPro technology developed, and they were training Creighton model teachers long before they were training medical doctors. And then
mhm.
solely medical doctors, there are doctors out there who want to practice good medicine that's in line with their faith and their patient's faith. But unfortunately, in medicine today, you're made to feel as a Catholic physician that if you don't prescribe the birth control pill, then you're practicing terrible medicine or inferior medicine. But physicians are searching for good medicine too, that's in line with their faith. So
Mhm.
slowly, physicians would start to come and train with my dad. And then NaPro technology has been around for over 30 years now. And in 2004, my dad published a textbook on the medical and surgical practices of NaPro technology. And I think around that time is probably when it skyrocketed in the training of doctors. So we have doctors trained around the world, all over every single continent except Antarctica. My dad always likes to joke, well, he hasn't figured out how to help the penguins yet, but
No,
they don't
no.
have a use for us. So and I actually get to work with physicians. I mean, I have conference calls with physicians from Europe. We talk about, you know, um, principles of Creighton model NaPro technology. We discuss difficult cases, Latin America. I mean, we a few years ago finished a project where we could do our training courses for the teaching Creighton model completely in Spanish so that they can train new teachers in Latin America, Central America, South America, and they don't have to come to the United States and take an English course. They can do it all in their
Oh, wow, what a
first language.
blessing.
Yeah, so all the doctors though, and with the physician side though, all the doctors end up coming to Omaha for their training. And so we have hands-on um teaching with them. So, but we just had an education course this past spring, and we had many doctors from the country of Brazil, and we have doctors from all over. So the problem is, even when we say we have doctors all over, there's still a need for more of us, actually.
Yes,
There's
there
still
is.
not enough.
No, there's a big need. And as you were speaking there about medicine today, if people are finally waking up, and I don't want to get you off track here
Yeah,
because
no
we got to
problem.
get to and that was such a wonderful way to lay this out. And if people, I'll put in the podcast notes, a couple of our prior podcasts with Dr. Hilger so that people can really understand, that even the surgical procedures, with endometriosis and things like that, so important, right? To actually heal a woman's body and
Right.
not just be out for the money. And look at, I know, and I'll say this because I met so many of the NaPro doctors. They all sacrificed to some financial gain, and so did your family over the years to get this out. And this is really a powerful thing, right? In a time, Dr. Teresa, where everybody's just so greedy and it's all about the dollar and these big
Hmm.
corporations. And here we have these lights again, these lights of people that speak the truth and they actually love what they're doing, love helping people. And it's very inspiring, very
Yeah.
inspiring.
I mean, growing up watching my parents, I didn't actually want to be a doctor because I saw how hard my
Mm.
dad worked. And I also saw
Oh, wow.
my dad was alone for a very long time on all of this. So to me, I actually went to Baylor to be a history teacher.
Oh,
So
wow. Isn't that
I joke because
something?
my first year of college, I prided on myself that I took no science classes. I took one math class because they told me I needed it to get into this honors society, which I ended up not applying for. But it's funny because God sometimes, I just remember towards the end of my freshman year of college, I just had this inkling thought, well, maybe I should be open to medicine. What if I don't want to completely close the door. That's the first time I ever thought
Mhm.
maybe. And I like to tell people I made a major U-turn, like history,
Yeah.
and I had to make up. But anyway, I saw how hard my parents work, and they still work hard to this day. I mean, they're still. My mom always jokes we should be retired, and they should be,
Yeah.
but they care so much about others that I have a hard, and they love what they do. I have a hard time thinking that they'll ever completely stop. But it was a lot of hard work for a long time. And so my dad was a lot of times the only physician, doing this. And so,
Mhm.
sometimes when
Wow.
you're a young kid and you see that, you're
Difficult.
like, oh
Yeah.
shoot, I don't want to go through the same obstacles and struggles. But now he's trained so many more doctors, and there are a lot more of us who think similarly or are trying to help our patients in similar ways. And now that I've had the opportunity to practice medicine, so I can't imagine practicing medicine any other way. It's so fulfilling, and how we take care of patients. And we do have a large population of women who are infertile.
Yeah.
But we tell our patients all the time, our number one goal is actually to help you feel better, because no one can guarantee a pregnancy, but you do deserve the opportunity to feel better, because many times, infertility well, not many times, infertility is a symptom of something else. It's not the actual
Yes, it
diagnosis.
is.
And many times these women feel poorly in addition to undergoing the infertility, struggle. And it is a cross that they bear. So, our goal really is to help build, help women feel better and build healthy marriages, support the marriage, support families and the children that might come out of these marriages, support healthy pregnancies and all that. So it's really wide reaching in many ways. And the more I do this, I'm so appreciative of the work that my dad put in. So now I have a different view than I did when I was little and saw how hard.
Yeah.
Yeah.
Well, they're so lucky to have you. I mean, I would think from your dad and mom's perspective, as they leave a legacy behind it, I mean, to be able to know, I know as a father, to be able to know that my children are behind me and
Yeah.
and can carry this torch, it's something very, very special.
Yeah, no,
You
it's
know,
great. And I have to laugh because, like any good child, we don't always listen to our parents, right? And
hmm
now I know I
hmm
always listen to my dad when it comes to anything health.
Yes.
Because there are a few times early in my career where I would talk to him about something, and he like, well, you should really do this. And I thought, no, I don't think I need to do that. And I always regretted not doing what he told me.
There's
So
some wisdom that comes with age, isn't there, Dr.
yeah,
Teresa? There's some wisdom that comes with
exactly.
age. We find the same
Exactly.
thing. As we segue to the topic today, let me just tell you a quick story. So I have three children. My youngest one is a doctor, a girl.
Right.
But anyways, when she was in high school, she had some issues with her cycle. And I remember um, my wife taking her to the doctor, and she came back with the pill.
Hmm.
And my wife wasn't Catholic, and so here I am, a practicing Catholic at that time. Came back into the church. Long story, but then I was studying John Paul II's theology of the body, Saint Pope Paul VI, Humanae Vitae. So I understood, all the things that we had done wrong, in our marriage. But then I understood from a Catholic perspective that you shouldn't be on the pill, right? Well, my wife and I argued about that because she said, "Well, Jack, it's not being used as a contraceptive. It's being used to help heal her body."
Hmm.
And I thought, I don't know about that. So I started to do a little work, and then my daughter, who was a pretty good athlete, and as an athlete, she's pretty in tune with her body. She wasn't on that pill for very long, Dr. Teresa, and she was experiencing side effects, and she got off of it on her own, and I was always grateful for
That's
that.
great.
And so let's talk a little bit about that, because there's so many women out there that just accept it, and it's not, to your point, it's not really healing the underlying issues, is it? And it's bringing some side effects that aren't good for a woman's body.
I think that's exactly right. And it's a great topic to discuss because, in today's society, too, on a national level, there's all this discussion about birth control now becoming over the counter medicine, and all of this. So, when we look at the birth
Yeah.
control history, it was originally designed for birth control purposes. It wasn't originally designed for health purposes, right? So you always have to think about medicines. What was it initially designed for? Now, there are many medicines we use for different things than they were initially designed for. But
hmm
when we talk about birth control pills, there are actually a lot of issues with it and side effects and all that. So it's interesting. This is a great topic. A few years ago, one of my Spanish colleagues at the time, she actually wanted us to kind of discuss, how do we discuss the topics when other physicians say, well, I have a patient with abnormal bleeding, so I need to use birth control for that. How do we discuss that? Because we talk about the ethical side and, what our faith teaches us and what the Catholic Church teaches us about, the birth control pill and contraceptives and all that. But what about the medical side? And how do we discuss that? So
Mhm.
that question actually caused me to actually dive into this topic, because what I realize is whenever we're in medicine, we actually have two responsibilities. And in order to determine whether or not something is good medical treatment, we have to make sure that, number one, that it is ethical treatment, because unethical treatments typically lead to more issues, more problems, more dilemmas. And we
Wait,
do,
let's
yes,
pause on that for a
yes.
second. Just everybody should take a deep breath right here because I was just thinking about this before you came on. I thought, wow, everything that the church has taught me through the years. And again, I got away from the church, Dr. Teresa, for 20 years. I
Wow.
was brought back actually on my brother's deathbed, who was dying of AIDS, who had come back into the church, brings us back into the church on his deathbed. And that started me on this path thinking, when the church tells you to do
Mhm.
something, it's usually good for you, and
Right.
not only for your soul, but for your body. So can you just say what you said again about this? Do you remember what you
Yeah.
said about this
Yeah.
ethical? Yeah.
So it is important that we have ethics in medicine, because
Mm.
unethical medicine leads to more issues. It never solves the problem it seeks to solve. It ends up opening, in some ways, a very small Pandora's box in that issue. I think IVF is an excellent example. The church is against IVF, and I do not recommend IVF. And there's many reasons for it. Many reasons, including what my faith teaches, but I have medical reasons and other reasons where I just actually don't think it's good treatment. But IVF, what does IVF now allow? Well, IVF has led to the issues with surrogacy. Surrogacy has a lot of issues with it. Selective reduction, when you have multiple pregnancies, there was a time where people would undergo IVF, the woman would then become pregnant with 3 or 4 babies. Now, what do? We don't want quadruplets, so let's reduce. Um, there's talk about 3 parents potentially. So IVF, and what do we do about storing all these embryos that are now frozen? So we've created actually further dilemmas, and the embryo storage problem is a huge issue.
It's a huge issue right
And we
now.
don't have a great answer for it, but that developed from an unethical medical treatment.
And
So,
let me just add one more because as I read and study and reach out to people that were born through a surrogate
mhm,
parent who never met, say, their mom, right?
right,
These are big deals, and I just bring it up quickly. It's another one of those issues. This is a human issue, and the mom herself, who
right,
is not being seen as a human being anymore, but it's just an object to use as a baby a manufacturing plant. And but then when you don't know your mom or you don't know your dad, this is not just no big deal.
right.
This is a big deal.
Well, there's a lot of talk too about, children who have are conceived with donor sperm, that they have a lot of issues when they grow up, a lot of questions of who I am, where do I come from, and
That's
there are
right.
books written on this. And so, what are we doing with these children? I think one thing that you brought up is the use of objects. So, we are actually taught to love people. We're
Mm.
supposed to love people and use objects, but in today's world, we are currently using people we use people and we love our objects. We love our materials, and so we have twisted ourselves into this is a really distorted way of looking at human beings. And I think a lot of that started with contraception, because what does contraception teach us? And this is a side effect of contraception. Contraception teaches us that it is okay to use the other person's body for our sexual pleasure or whatever it might be, right? Um, and it's not for because you necessarily love the other person for the betterment of that person. The Catholic Church teaches that contraception is wrong because there's a unitive and procreative aspect to the sexual intercourse that married couples undergo, and you cannot separate the two. But contraception seeks to separate the two. And so innately, it's going to teach us that other people are objects to be used for our desires or pleasures or our impulses, whatever it might be. So there's a whole issue there. And you could argue that that is a side effect of contraception. But when
Yes.
we talk about medicine, so it is important that when we are treating patients that we are ethical and that the treatments we utilize are ethical. But the second issue, so there's two criteria, I believe, for good medicine. The second issue is, yes, it has to be ethical, but two, it has to be good medicine. You have to have research behind it. It needs to be sound. So we have two criteria we must meet when it comes to medicine. Now, medicine is science, right? And when it comes to science, asking scientific questions, we don't know all the answers. So sometimes you have to ask a question.
Mhm.
Okay, now how am I going to figure out how to answer this? And
Yeah.
sometimes we propose a theory and we might be wrong. Okay, but then be honest. Hey, this was wrong. But we're going to continue to seek. So when we talk about contraception, then I
Boy,
think
I'm not going to get you off track, but when you say those things, there's a whole host of questions that I'm sure in the audience's mind too. I mean, just all the things that we see in
right.
medicine and science today, where we're not asking those questions. What you're talking about, again, when you seek the good of a human person first, you start asking these questions, and there's another side effect when you don't. You
You
can
stop.
go, you can, yeah,
Yeah, it's actually really bad to stop asking questions, because how do we continue to learn and understand? It's by asking questions, like children ask questions all the time. Why? Because they don't know or they don't
yeah,
understand. But we don't say, hey, stop asking questions. Now, maybe if they've asked you 20 times, why is the sky blue?
yeah,
Maybe you
yeah,
might say, hey, we don't need to
yeah.
ask that question. But normally we find it endearing. But we have to ask questions, and that's the process through how science
Mhm,
continues to move forward.
mhm.
And if you stop asking questions, science will stop and probably move backwards, because you're going to lose ground on the research that you could have had. So when we talk about contraceptives, then one of our objects that we have to discuss is whether or not it's actually good medicine. So I think that's a very important thing. And now I know that probably over 90% of the physicians in this country and probably around the world will say, yes, it's good medicine. It's used all the time, all that. And that's a lot of it is related to how we are taught in our medical training, our education. It's just ingrained in us that you use contraception for all sorts of things. So there's, for example, ACOG, which is one of the OBGYN societies within America. They have these practice bulletins that you read as a physician to understand guidelines for taking care of certain conditions. And one of them discusses the use of oral contraceptives for proposed medical benefit, or for proposed like non-contraceptive benefit, essentially to treat medical
Mhm.
conditions. So the argument is that birth control pills will treat the pain associated with periods. It will treat heavy bleeding. It can, and there's many different things that they list, and this is just a few of them. Also, it decreases the risk of ovarian cancer and colon cancer and uterine cancer. Now, I think cancer, when you say something decreases it, oh my gosh, we need to discuss this, and
Yeah.
why is not everyone on it? But on the flip side, there's actually issues with how we discuss these things, because the question is, what is causing the pain with those periods?
Mhm.
And the birth control pill actually only treats a symptom. Now, one thing in NaPro technology that we do a lot of is we treat a lot of endometriosis. Women with infertility have very high rates of endometriosis, for example. And a study my dad did years ago, out of 660 infertile couples that came to him, 77.4% of them the women had
Ooh.
endometriosis. Now, we actually wonder if it's higher than that, because it seems like more and more women have it. But one common thing that you will find in women with infertility is they were put on the birth control pill when they were in high school for painful periods. Maybe they stayed on for 10 years. Some women stopped the birth control pill because they didn't like the side effects. Could be emotional side effects, could be abnormal bleeding. Many times women stop the birth control pill because, you know what they tell me? It didn't solve my pain. I did this birth control, then that birth control, then this, and nothing worked.
I mean,
So
trying
they
different
stopped it.
kinds of
Yeah, they try all
different,
sorts of
yeah.
different kinds and it worked. But when they want to have a baby and now they've stopped the birth control and they've been trying for 5 years, let's say, guess what they have? Endometriosis. It never got rid of the disease. And now we've created a new problem. Because if we had solved that problem when she first arrived, when that woman first came to the doctor's office as a teenager complaining of pain, we should have figured out what was causing the pain at that point. Instead, they get put on the birth control pill, and now we delay the process of that treatment, and
Mhm.
now it's wreaked havoc on her body. It's very
So
inflammatory.
so young women at that age, even in high school, already have endometriosis?
Oh, we have I have seen some really um
What causes that? Is that too hard to, don't
yeah.
don't let me take you down
No,
that
you're good. You're
rabbit
good.
hole.
Well,
If
no,
if
yeah, I mean, it's a whole nother topic, but there's a lot of arguments about what causes endometriosis. The old argument was that when women menstruate, some of that fluid comes back out through the fallopian tubes, retrograde menstruation and implants into the cavity. That was the long argument for it. A lot of people now are not so sure that that's the correct thing. But some people argue it's autoimmune. Some people argue that we're born with it, it's embryologic. We still don't 100% understand it. And to be honest, I would argue one reason we don't understand it as well as we should, it's really a terrible condition, is because we we put so much money and research into birth control pills, and not
we
enough
haven't really,
of that effort goes to the endometriosis side. But what we see all the time here is that women are just kicking the can down the road for when their disease actually has to get addressed. And it is well known that women with endometriosis, there's a long time of delay to that diagnosis, typically between 7 and 9 years before they're formally diagnosed
Mm.
with the
So
disease.
you're saying, if I hear you right, that this is a progressive disease. In other words, if we don't treat it, will it always? Does it tend to get worse? Do you think, or?
Yeah, it rarely will it you find it regress, so go
Mm,
improve. Typically what you'll find is it either stays the same or it progresses.
okay.
But birth control pills are argued to actually be a treatment for the pain related to endometriosis or painful periods, but it
Mm,
doesn't treat the underlying condition or the disease, which has many ramifications for the woman's long-term health as well and her future fertility. So when we operate on patients here at the Institute, sometimes patients come to us because they're on birth control for pain. There is an argument that birth control suppresses endometriosis. We ask patients to actually stop the birth control pill before we operate on them so that we don't miss any of their endometriosis. I think that the birth control pill probably alters the appearance of some of the small lesions of endometriosis, but I could show you. I mean, you would be shocked to see how much endometriosis these women have, and they are only been off the pill maybe 2 months. That did not arise in 2 months from being off the pill. That was there all along.
mm.
So it didn't improve the disease. Now, one question is, so the rate of progress? Well, again, I would argue if you treat it right at the beginning, you're gonna give better results later on. So that's one thing with the birth control pill. And I think too, the other thing with cancer, this is a really big one because we have to be honest when we look at these issues. And, as I mentioned, birth control pills have been shown to reduce the risk of ovarian cancer, colon cancer, and uterine cancer, but they are known to increase the risk of breast and cervical cancer. Now, out of all of those cancers, breast cancer is the most common cancer. So women,
And it's common today. I mean, it's really
yeah.
common.
And if you actually look at the rates of cases that are diagnosed each year, it's actually increasing. So you can find these statistics online, but over the last 20 years, the new cases of breast cancer are only increasing and they're not decreasing. And we
Mm,
spend all this money into research, all this money, right, to figure out how to treat breast cancer because honestly, we want to reduce the risk of cancer, we want to reduce the rates of cancer. We want to create better treatments for women with cancer. But there are a lot of studies out there that actually show that history of birth control, oral contraceptives, for example, increase the risk for breast cancer. And in some studies, it shows a 20 to 30% increased risk, which is a large risk. And there's a few studies that definitely show that it increases the risk in women when they were put on the birth control pill before their first first full term pregnancy.
mm.
So that's gonna be most of your teenagers.
And they're being told the opposite then is from right. They're being told that it can reduce
Well, they'll be
cancer and
told
some.
that it reduces ovarian and colon cancer,
Oh,
uterine
okay.
cancer, but out of
Okay.
all those numbers, breast cancer far and away
Is
is
higher. Okay,
is
gotcha.
higher. And you know, the other thing too is many people actually will say birth control pills don't increase the risk of breast cancer. Doctors will argue that that's not true. but there are multiple studies that show that this is true and it does occur. And they're not all from the 80s, these studies. I mean, there are more recent studies that show that. So this is something that's been shown. But when a woman, let's say a 17-year-old teenager goes into the doctor's office and her mom is there with her because she's a minor, and they are talking about putting her on birth control for acne, one of the questions I have is the physician informing them that, well, this may increase your daughter's risk for breast cancer? Because if that were my child, now acne can be very serious and there's a lot of issues with that, especially socially. It can be really,
Yeah.
really tough for people. And I'm not
Yes.
trying to diminish that at all. But if I were a mom, I would think, oh my gosh, do I want to treat the acne with this, or do I want to find something else where maybe I won't increase my daughter's risk for breast cancer 20 years from now or 40 years from now?
Yeah. And what else could that daughter expect? Because again, my daughter, and it was a long time ago. I should have called her and
Yeah.
asked her, if she remembers exactly what that
Yeah.
was. But there's other, physical and emotional effects, right?
Right. Right. So some women complain, well, first off, a lot of women will complain the reason they went on the birth control in the first place, whatever the medical condition, it actually never took care of the issue. So that's one complaint you'll get, that the reason I went on the medicine in the first place, that issue was never resolved. A lot of women will complain of abnormal bleeding on it. You will hear women complain about headaches when they're on it, mood swings, a lot of different things, and every woman's a little different. And every medication just about has a side effect to it. And so how one woman will respond to a medication might be different than someone else. And you will have women say that they feel really great on birth control. But I think one of the things we just have to discuss is that in our society today, we do lift birth control up as this amazing treatment for women's healthcare, right? That everyone should be on birth control for all their gynecologic issues. It's just this amazing medicine, and we should allow everyone to be on it. But it's kind of ignoring the negative side effects of it. And there are negative side effects. It doesn't solve all the issues, and there are risks associated with it. But you don't hear that discussed hardly at
Mhm.
all in the conversations that we have today. And to be honest, if you're going to solve problems, you have to be willing to ask those questions, and you have to be willing to be honest with people too.
Yeah. Well, not only that, for young people, I'll tell you a side effect that some people don't think about. It takes one of the barriers down, the fear of pregnancy down, and so you have an increase in promiscuity, sexual activity, and then you have an increase in STDs. I
Right.
mean, I
Right.
I heard stats. I had a Dr. Miriam Grossman on the show some time ago talking about some of these trans issues, some other things.
Mhm.
But she identified this very early when she was in counseling, and now she's a PhD, Dr. Marion Grossman, not an MD, and in psychology. And so what she was finding is all of these women coming in that were on the pill for years and years and years, with not only STDs, but with real emotional problems from getting back to our earlier conversation, from being used and abused, and also not feeling good, from being on the pill. So there was a lot of issues there, and she tried to, and I remember, I don't know if she said she just tried to get them to go off of. I don't remember exactly that conversation anymore, but she identified these issues early.
Well, it's interesting because one thing my dad, I was with him one day and he was watching the news and they're talking about birth control and, women deserve the right to control their bodies. And I remember my dad made the comment that they don't even know what they're trying to control. Okay,
Mm.
so you could listen to that comment and go, well, that's kind of harsh, but what does that mean? What he was really saying is actually women have a very poor understanding of their menstrual cycles and their reproductive health. I have women, when I tell them they need a chart Creighton model, they come back and they go, I'm embarrassed. I'm in my 30s and I didn't know this about my body. Or I wish I had learned this years ago. And I hear this, I mean, you'll hear this over and over again. Women actually do not understand how their body works.
Mm.
Another great example is women will often say, my husband looks at me and I get pregnant. Well, no, that's not how it works. But what they're saying is one act of intercourse and they're pregnant. But if you actually understand how your fertility works, that actually is not necessarily inaccurate, because if you have normal fertility, and when you're fertile, 76% of couples will be pregnant the first cycle they use fertile days. So that's normal. So what you have to understand is when you're fertile and when you're not fertile, and then make a joint decision as a couple. Are we going to try for a pregnancy this month or not? Is this a good time or not? And so, we there's a lot of things that women actually don't understand about their bodies, but we've been taught that the birth control is so crucial to what we do. And yet we don't realize how it really damages our relationships. It can change, a lot of these birth control pills have these very potent artificial form of hormones that have negative side effects to them. They can change your mood, your personality. Some of them have more testosterone
Yeah,
derivative.
let's dwell there just a little bit,
Yeah.
because I think that's kind of what a lot of women that I talk to, I mean, it even it decreases their desire for sexual activity for with their husbands. And I wonder sometimes if it's because they've been on the pill so much, they're being
Yeah.
kind of used, even if it's
Yeah.
not planned that way, being used as an object, and then finally, just get tired of it. But there's also some actual physical reasons for that, isn't there? That their libido's decreased,
Yeah, I mean, some women complain of fatigue when they're on the birth control pill, or just an overall generalized not feeling well. And then you try to figure out what's going on. And they've been on the pill for so long that sometimes it's hard for them to realize it was because they started the birth control pill. Or you also have to think, could it be the underlying condition maybe they're trying to treat with the birth control pill is never properly treated? And you're just taking the
Mm-hmm.
medicine, and that condition is just smoldering underneath and not ever getting addressed and not getting better. And then the other thing too is what's its negative impact on the relationship. I think it's really important that we talk about using people. Well, the husband can use the wife and the wife can use the husband. It can go both
Mm-hmm.
ways. You hear about women who, well, I stopped my birth control and didn't tell my husband so I could become pregnant. Well, that's probably not the best way to try to have a baby. That's
Mm-hmm.
actually, you could argue, using your husband just to become pregnant. But in
Yeah,
today's,
that's a good point. Sometimes as a man, I think, we're always on the bad side of things, but it's not
no,
true. It takes two
no, it's not true.
yeah, it
No,
takes
it's not
two.
true. When it comes to relationships, there's two people in the
Mhm.
relationship, and
Yeah.
relationships are hard. They take work, and most of the things that are worthwhile in life are hard and take work, right? But so yeah, I think the birth control pill, there's a lot of issues with it. And number one is the funny thing is everyone thinks we need it to actually practice medicine and to treat these conditions. Well, I can tell you, I graduated from residency in 2016. I did a 1 year fellowship. So I've had my own patients for 7 years. I've never needed to prescribe birth control in all those 7 years. Never felt like, man, I wish I could prescribe birth control right now.
Mm.
That'd be real handy. Because we have a lot of good treatments for a lot of these conditions that do not require the use of the birth control pill, feeling better, and their husbands love it. So one condition I love to treat is premenstrual syndrome, PMS, that we all talk about, because everyone thinks
Yeah.
women are crazy right before their period. You gotta
Yeah.
stay away from them. A funny aside, my mom, she one time, I have four brothers and three older ones, Paul, Stephen, and Michael. One time they were really testing her, they were little and testing her. And they go, Mom, you have PMS. And she looked at them and she goes, You're right. I have Paul, Michael, and Stephen.
Oh, that's fantastic.
And for my mom,
She's
that's pretty quick.
Yeah, yeah.
So,
Or either that, Dr. Teresa, or she was thinking, man, someday I got to use this, right?
yeah, yeah, right. Oh, maybe
Finally,
she was
finally.
planning it.
Yeah,
Yeah.
finally I get to use this.
No, they're great guys, but here's the thing about PMS. Everyone just thinks women are meant to be crazy. Right before
Mm,
their period, they're going to get irrational, emotional, they're going to feel terrible. Actually, no, PMS is a sign of ovarian dysfunction. It's typically a
mhm.
sign of abnormal hormones. And a lot of times when I treat patients for this,
Wait, wait, wait.
exactly.
Yeah,
Yeah,
say that again. I think this is
yeah.
going to be really good. So what's off here? If
Typically there's a combination, so there's three hormones that are meant to be normal in the menstrual cycle.
mm,
Progesterone, after ovulation, progesterone's created. Progesterone is a hormone. It does a few different things that are really important. And if a woman becomes pregnant, it continues to be made. So if she's not pregnant, it will drop off and then she'll have a period. So a period starts when that progesterone withdraws. Estrogen is an important part of the cycle. And then one hormone that we can no longer, um, evaluate is beta endorphins. So those three hormones play a big role. But in women with premenstrual syndrome, what you often find is that they are low in one, both, or all three of those hormones, and
Oh,
progesterone is
wow.
typically the major one. So the PMS is their symptom that something is wrong. Now,
Mhm.
interestingly, women with infertility and a history of miscarriages have high rates of PMS because they have hormonal abnormalities, and that is one of the contributing factors to their difficulty conceiving and or maintaining that pregnancy. And they feel so poorly, before their period starts. And then what happens is, how does PMS impact the woman? Well, a lot of times she takes it out on her husband or her children. And when I treat women for PMS, I will ask them, does it make you feel like a terrible mother? And they will say yes. Or a terrible wife.
Mhm.
They say yes. Because
Wow.
these are the people I love the most, and they're the ones I take it out on. I've had women tell me that their coworkers notice how bad their PMS is. So think about that. So let's say a woman has really terrible PMS. A birth control pill isn't necessarily going to fix that. Okay. It's not the right type of hormones. It's not the right type of hormones at the right type of the cycle, time of the cycle either.
Mm.
And so now you have a woman who already feels terribly physically, and she realizes how she's acting towards her loved ones. But then you've got a husband who has no idea what's going on with his wife, and she switches on him in a moment. And he might think, this woman, I can't believe I married her. Where does
Yeah.
that take them? And
Yeah.
so I often, in all seriousness, but also joke that we could change the world if we just treated PMS, because we would
Yeah.
build healthier relationships, people would feel
Yeah.
better. It is a cause of infertility and miscarriage. So there's a lot of things, are the woman's moods are related to a lot of those hormones. And the woman feels like she's a terrible person. I just tell them it's your ovaries not working right. It's actually not you as a person, but it's your ovaries. So we need to fix that. And most of the time they feel better. It might not be 100%, but they feel significantly better. And that's important.
Yes, amazing. The other thing is, and I am afraid to go here, but just so people know, if women are suffering from miscarriages too, a lot of times aren't those hormones are off
Mhm.
too, and you can fix those, and people don't realize that. I've had women in an audience when I'm talking about human sexuality and stuff,
Yeah.
um, cry because they've had 3 or 4 miscarriages and they weren't able to get pregnant. When I mentioned that they should reach out to a NaPro doctor, and I said, let's have this conversation afterwards because, I don't want to take the time sometimes in that talk, but I just said there's ways that they can help you
Okay.
and understand the underlying issue there. You want to just touch on that, without you don't have
Yeah.
to go too deep with
No,
that.
I mean, it's great. I mean, so when it comes to our fertility, women know that they're designed to have babies. Like, part of our design is to become pregnant, and have babies. And so when it doesn't work, whether that's infertility or the inability to carry your pregnancies and have recurrent miscarriages, that actually is a big cross for women to suffer from. So when that happens, we know that there's something wrong. There's something causing this, because normal fertility, that should never happen. And so with infertility, what we find is a lot of women have endometriosis, abnormal hormones. But guess what? That crosses over a lot to women with miscarriages. So women with miscarriages also have high rates of endometriosis, hormonal abnormalities, and other conditions that basically create an environment that is not supportive of that pregnancy and kind of protecting that new life. And so we need to really work at figuring out, we don't know all the causes, but we know quite a few causes of recurrent miscarriage, and you have to work at it, and you got to dig in and figure out what is the underlying cause, and to the best of our ability, how can we treat it, and address it.
Yeah.
And when you start treating conditions that way, what ends up happening is you start asking more questions. We were talking about questions at the beginning. I have some patients that are real puzzles to me right now. And it's like, these are the questions I need answered, but they're not answered in the medical literature. And
Yeah.
one thing I love about NaPro technology is I do think in many ways it's going to allow us to solve a lot of these questions, because what it does is it forces us to actually address the problem and think. We really have to think when we practice medicine this way. And I can come up with 10 new questions in a day, when I'm looking at these conditions, and they're not answered. So how are we going to work at answering them? How are we going to
Yeah.
try to solve it?
Yeah, and the doctors so often, again in Illinois, especially in the Chicagoland area, it's all IVF. I mean, they want to put you on, and it's a huge cost. First of all, it certainly isn't a high success rate unless you're doing it over and over again.
Right.
Obviously, the success rates will go up, but they're still not getting to these underlying issues, and often they'll still even miscarry then. And
Right.
so a NaPro doctor is at least going to work with you to say, let's get your body healthy. Let's figure out if there's other issues going on, and let's try to heal you up, right? And get
Right.
your, hormones
Right.
stable. Make sure you don't have endometriosis. So this is just such a better way to go. And unfortunately for for those trying to make a living on this, it's much less expensive, right? I
Right.
mean, what
Right.
you're doing is much less expensive, and there's some sacrifice involved, for free on the doctor side, because I meet NAPRO doctors all the time, just talking to them, and they're passionate about
Mhm.
really helping women. It's a whole different person, a doctor, when you
Right.
talk to NAPRO doctors. I would suggest everybody at least go in and
Yeah.
meet with one at least.
Oh,
Initially, you can
yeah.
always,
No.
try
It's
other things later on, but you're going to meet some real beautiful human beings.
Well, it's great you think that way. I mean, because ultimately we're here to serve and help take care of people. And, you know, going back to IVF, there are a lot of issues with IVF. And we actually know that pregnancies that arise from IVF have higher complication rates and higher anomalies, actually, not even related to
Mm,
chromosomal issues, a lot of birth defects associated with IVF. So when you think
mm,
about IVF, one way
mm.
we talk about it
I
here at
didn't
the
realize that.
Institute, yeah, is yeah, there's research that shows that. One thing we talk about at the Institute a lot, we know that infertility is not the diagnosis. Infertility is a symptom. So that body is telling you it can't become pregnant for a couple reasons. One, the body is sick, or maybe the woman isn't ovulating, or the husband doesn't have sperm. Maybe or the tubes are
Yeah.
blocked. Like there's a physical roadblock there. But when you're putting, so if you don't figure out why the woman's body is sick or the man's body is sick, and you do IVF, but let's keep it to the woman for a second, and you skip the process of figuring out why they're not getting pregnant, then you force a pregnancy on a body that's sick. We should anticipate bad outcomes because that body is telling you, I should not be pregnant right now. I have endometriosis, I have hormonal issues. Like
Oh,
there's a
wow.
reason I'm
Yeah.
not pregnant.
Yeah.
So it's telling us that there is issues, and we
Mm.
skip the issue, and we're like, well, let's just get to the end result. And that's really a terrible way to go around, because whenever we take shortcuts and we just try to get the result we want, guess what? It never works out well. I mean, how many times have we taken a test and we're like, I'm going to get an A on this test?
Yeah.
I didn't study at all. Then why would I be
No.
surprised I got a D on that test? Because I
No.
didn't study, I didn't prepare, but I wanted the A,
Yeah.
or let's say somebody cheats on their test to get the A. Well, guess what? You might get caught. There might be issues, bigger penalties if you had just prepared for that test. So, whenever we try to skip to the end result that we desire without the work and without the due diligence we need to give it in between, we're going to ask for results that are not what we anticipated. So the anticipated result of IVF is pregnancy, but there's a lot of negative issues there that doesn't get talked about, actually. It's really, there's a lot of issues with IVF, and it's there is an ethical component to it, but there's medical issues with it, financial issues. There's a lot of issues that have developed from it.
Um, we're gonna wind down on your time here.
Sure.
Uh, two things I like to ask you, and again, we can go very quickly with this, and
Yeah.
we're gonna try to get you back. I know it's not easy to get you back, but
Oh no.
I work on Sue. I work on your mom.
Yeah, she's the
She's
she's the
so
best.
precious. Yeah. But for people that are on the pill, you know, talk about the other side real quick. Talk about, we have a natural way, that if you have to put off having children for whatever reason that is, that this works. That the success rate or the prevention rate isn't it as high as taking the pill, or very close,
Yeah,
right? I mean, the stats when you're practicing natural family planning to avoid now, on the other hand,
right,
and then
right.
and the second thing is, just before you go, you got to give me some resources, and maybe tell us where we can find a NaPro doctor,
Yeah.
where they can reach out. I'll make sure I put the Pope Paul the Sixth Institute, in the website there. But if they have questions and stuff, and then if there's any particular resources that you like on IVF and
Yeah.
or NFP, if there's any favorites you have, because people are always say, where do I start, looking for
Right.
this,
Right. Well, I think, they're really good questions. And one of the things too is, when we're Catholic, everyone thinks that we're going to have 10 or 12 children.
Yeah.
And that is actually the decision between the husband and the wife. So some people, they actually do need to avoid, and they've chosen a smaller family for whatever reason. And you never know why that might be. And real quick, on the flip side, sometimes people choose to have big families. And a lot of times when you see a big family, people assume that, well, after the third child, they just didn't know what they were doing and had 8 unexpected children after that. I'll tell a quick story about that. I won't be too long, but I
Uh-huh.
had a medical student with me one day,
Yeah,
and
I
I
love it.
had an infertility patient come in, and I happened to ask her, well, if you could get pregnant, how many children are you guys discussing? Like, would you like? And she said 4. And to me, 4 is not bad. I mean, I was one of 5. 4 is very normal to me. The
Hmm.
next day, he runs up to me because we're in the operating room. He goes, Dr. Hilgers, I have to ask you a question. And his eyes got big. He goes, and I'm like, oh no, what does he need answered? He goes, do people really want 4 children? It astounded him that actually people were choosing to have 4, because he
Isn't
goes,
that
all I know is
something?
people who want 1 or 2. That's it. I've never heard anyone actually say they want 4. So, really, it's the decision to have more children is between the husband and wife. And it should be a prayerful decision too. As a physician, my job is to tell them if they have a serious medical reason to avoid. I have to tell them those things, but it's not my decision how many children they're going to have. So
Right.
people
And
use,
and and, and just to stop you for a second, because you're making such a good point. The Catholic Church never said we're going to get involved in how many children you have,
no,
right? We always
no,
say, pray on this, discern,
right.
go see your priest if if you want to hear more about that. But it was never about how many children or not you're going to have. It was always about the incredible beauty of the sacrament,
Yeah,
where two people are pouring themselves out, in lovemaking,
right.
and there's no barrier there, right? There's
That's
nothing to
exactly
say.
right.
So I talk about that a lot, so I won't make you go there. But
No,
that's a great point, that people should understand that this is not, the Catholic teaching is not about how many children you should have.
that's exactly right. And if you want to talk about true freedom, freedom
Mhm.
is understanding what your cycles are doing. So you and your husband, or husband and wife, whichever way, whoever um, is the one thinking about it, you have the ultimate decision as to whether or not you're going to have more children or not. And that's actually
Yes.
freedom. The birth control is not
Right.
freeing. Um, so when it comes to the Creighton model, for example, so I had mentioned that women with normal fertility, or I should say couples with normal fertility, 76% of them will become pregnant the first cycle they try or use days of fertility. But if you want to avoid pregnancy, the effectiveness at avoiding pregnancy is 96.8%. The birth
Wow.
control pill is actually 91%. So it's actually more
Wow.
effective than the birth control pill. And
Wait, now
yes,
let's another deep breath for everybody
yes,
to listen, right? That
yeah.
this is somewhere around a 4 or 5. Is that about 5%? Is that what that is? The
Yeah,
math real quick.
so when you look at, yeah, so it's 96.
Higher,
Yeah,
right?
it's higher. So 96.8% effective with the Creighton.
Wow.
And you do work with the teacher, so you learn how to understand your cycles, how to interpret it. So that's important that there's a teacher involved, a trained professional who understands this. But the birth control pill, it is out there. Even if you go to CDC, 9 out of 100 women will have an unexpected pregnancy
Hmm.
who are on the birth control pill. So that's 91%, right?
Yeah.
Are
Yeah.
avoiding, or so 9% will become pregnant. So 91% effective at preventing pregnancy is how they
Right.
like to term
Right.
it.
Right.
Now, depending on what form of contraception, you can go higher. I mean, they love to advocate for IUDs, and that's a whole nother discussion. Actually, IUDs have a lot of issues. They're potentially even more abortifacient than birth control
Mm.
pills. So there's an ethical side, especially for those who might be pro-life. Um, the IUD has different, its mechanism action really works on thickening this cervical mucus, but also thinning the lining of the uterus. Ovulation rates are actually still quite high on women with IUDs because it's more of a local effect. So one of the arguments against them ethically and morally is that you could potentially cause of an abortion by preventing that baby from implanting.
Mm.
But again, I think it goes deeper than just that. So actually, when it comes to natural family planning, I mean, for years, what they called it, well, the old rhythm method, right? What was it? The
Mhm.
Vatican roulette. I mean, all these
Yeah, yeah,
nicknames. You
yeah.
didn't
Which
know if
didn't
you're going
work
to get
well.
pregnant.
It didn't work
No,
really
it didn't
well.
work well. And you know what? Rhythm wasn't going to work well. When you look at how rhythm was designed, and you understand the fertility of and the menstrual cycles, you can say, yeah, no kidding, that was never going to work. But do you know that we've made so many advances in the last 50 years? And a lot of it related to my parents' work with Creighton model and NaPro technology,
Mhm.
that we, in fact, even have a way where we can avoid pregnancy, allow couples to avoid pregnancy with 100% effectiveness. So for
Mm.
those couples who have a serious reason to avoid, there is a way to naturally or to monitor your cycles and avoid pregnancy with 100% confidence. And you don't need to be sterilized. You don't need to be on the birth control pills for that. And my dad actually published this in, um, I think it was a Lineker Quarterly. I think that's the correct. I think it was 2019 off the top of my head. But,
Yeah,
that's just a few years ago where we had 600 cycles of women who had reasons to void. And what they did is they did a blood test to confirm that they were after ovulation, and then all active intercourse occurred after that. Not one pregnancy occurred. And so, we have to help our patients. There are couples out there who really should not become pregnant, and they need a moral way to do that. And so, the other thing too, I know I'm kind of, you could take me down the rabbit hole, but the other thing too is for
yeah.
our priests. It's important for us to support our priests so that when they talk to couples, like, look, you shouldn't be on the birth control pill, it's against Catholic teaching. We need to also give them good medicine that they can say, go talk to this doctor. They can help you. Because I feel like sometimes our priests, they get stuck. Like, this couple is this is a
That's
serious
right.
issue, but how am I going to help them? I don't know. And their doctor is saying, put them on the birth control pill. You know what I mean? So if we can
Well,
help each
here,
other. Oh,
Dr. Teresa, this is exactly why we're doing this today.
yeah.
I mean, this is a main reason is
Right.
to help these conversations because these conversations are not elevator speeches, you
No.
know? And
Right.
so you need someone like you to kind of help them unpack this. And
Right.
so think about a priest today. I'm going to reach out to my priest community, our priest community, and make sure they have this
Yeah.
because they can say, before you come in for your next session, your
Yeah.
pre-K, kind of thing, right? And he's meeting with a couple before they get married. He can say, go watch this video, go
Right.
watch this
Sure.
podcast, or go listen to this podcast, and then come in my office.
Yeah.
See, that helps. Look how that helps. You really provide by doing this and taking the time today. You really provide a gift to those priests.
Well, and it's just so important that we help each other out. We want to support, the Catholic Church is completely correct on its current teaching of contraception. Just, I want to be very clear. The church was correct and is correct. There's no need to change its teaching. What happened with Humanae Vitae? Humanae Vitae, everyone, real quick. I know we're going to go long, but Humanae
If
Vitae,
you're okay, I'm okay. I
I'm
was worried
okay.
about you. This is
No, I'm okay for
fantastic
a little bit.
information. Okay.
But I'll keep it short. But Humanae Vitae, everyone
No,
thought the
take your time. Take your time.
okay.
We're good.
Um, everyone, from what my parents tell me, everyone thought that the birth control pill was going to be accepted
That's
by
exactly
the
right.
Catholic Church in the 1960s. And a lot of people within the church, I think, even did. They had a birth control commission, all this. But Pope Paul the Sixth,
Overwhelmingly
yeah,
supporting,
that's exactly
the
right.
pill. Yeah.
So
Yeah.
Pope Paul VI, sometimes when you wonder, about the Holy Spirit and all that, I'm telling you, I think Humanae Vitae, that was Holy Spirit guided because this man had everyone telling him, you need to reverse the teaching, but he didn't. And
No.
I would actually encourage everyone to read Humanae Vitae because it's actually a very beautiful document. And there's definitely, he foretold some things that have come true, that
I
did.
think in number 17, if somebody
Yes.
wants to have a cheat
Yeah.
sheet, pull it up.
Yes.
You can just pull it up at the Vatican's website,
Right.
I think, right?
It's
And go to
great.
number 17. And
Yep.
you go, holy cow, how
Yes.
did anybody know this before it
Right.
happened? And it all
Well,
happened.
and like my dad likes to say, back then, there weren't really a lot of great methods of natural family planning. A lot of it was the rhythm, you know, in the 50s. And the Billings, I'm going to draw a blank when they first started, but they were the first method probably that really looked. My dad's a better historian on this than I am,
Yeah.
so I
Yeah.
might maybe I'll skip that so I don't say
Yeah.
the wrong dates and offend anyone. But you know, really, the Billings method was a great start, you know, in a lot of ways. But what I want to just talk about real quick is kind of the power of saying yes and to saying strong. So Humani Vitae, Pope Paul VI, obviously, clearly, this was a major um, stand-up moment for him where he really stood against the crowd on this one. And
Yeah.
he
He
wrote
did.
a beautiful
He
document.
struggled. He struggled.
Yeah,
Personally, he
he really
struggled.
struggled with it. And you know, my dad was a medical student, and he's probably told this story, but he was a medical student and knew that the church was potentially going to change
Mm.
their teaching on the birth control. And when Humani Vitae came out and they did not change it. So my dad, you know, kind of the curious mind he is, wanted to read about it. And when he went to his Newman Center at the University of Minnesota, the chaplain there, when he asked for a copy of it, said, "Well, what do you want to read that trash for?" Okay. So my dad was like, "Okay, well, that's not going to work."
Isn't
So
that something?
yeah, so he found an ad in the newspaper. I think it may be in the Minnesota Tribune, but I couldn't tell you because he was in the Twin Cities at the time, from the Knights of Columbus, where if you sent in, I think, a quarter, you would get a copy of Humani Vitae. So that's what he did. And he read it. And when he read it, it changed his life. And because of Humani
Oh,
Vitae, that's what got my dad doing more research in the natural methods. And then he, along with my mom, Diane Dale, and Ann Preble, developed the Creighton model. And from Creighton model, we have NaPro technology. None of
wow.
that would have happened
Wow.
if Humani Vitae and the Catholic Church had not stayed true to the teaching. And I can tell you, as a physician practicing NaPro technology, this is the best way to take care of women and their health care. It's so fulfilling. Granted, it can be frustrating as all get out because there are still conditions we don't understand. We're still learning, but we
Mhm.
know so much about what's going on with the woman's body. And it's just a beautiful way to practice medicine. It's respectful of the woman and her dignity as a human person. If she's married, it's, you know, it respects her marriage and her children. And so, but I often think about, man, it all started with Humani Vitae. And if that never happened,
Wow,
this
I got
is,
goosebumps when you're
yeah,
saying that. I really did. I got goosebumps. Usually that's a Holy Spirit moment to
yeah,
me. I
yeah,
really mean it. When I'm talking to somebody and I feel that, it's like a Holy Spirit's just like pushed on my
right.
spine just a little bit.
Yes, no,
This
it's
is important. This is good.
well, and you know, sometimes who was a person who one time said, "What the Catholic Church is so forward thinking, everyone thinks it's old fashioned." There's somebody famous said that. I can't remember who it is. I'm terrible with stuff like that.
Yeah, yeah. It's probably
Uh,
somebody like G.K. Chesterton, but who
Probably somebody
knows?
like that.
Yeah, yeah, yeah. I have to
But
look that one up.
I think Pope Paul VI was forward thinking on the teaching of
Yeah. Oh,
contraception.
yeah, for sure.
And yeah,
And look at
so
John Paul's theology of the body came out of that.
yeah,
And it was really, how do I explain this biblically?
right.
And then the beauty and the power of that, to understand that love making between a man and a woman is really making visible the
Hmm.
Trinitarian love story. The
Yeah,
Father who gives his love to the Son, and the Son receives that, and the beauty of that comes out in the form of a person, and a
right.
man making love to his wife, and his wife receives that, and the beauty of that sometimes comes out in the form of a person. We are a tiny sacramental reflection of Trinitarian love in the world. When
Yeah.
people get this and the grace comes into their marriage, I mean, I know people that had no idea what the church's teaching is,
Hmm.
and you're in a conversation with them, and they go, "I know when my marriage got bad. I
Yeah.
know why I got divorced." And I would say, "Well, why? And how did you know?" He goes, "It's when we started to contracept." And
Yeah.
he goes, "It took me a while to look back on it, but that's exactly what happened, and I know it." And when you start to unpack these issues that you and I are talking about, they go, "Ah, okay,
Hmm.
now I understand." But even though I knew it already,
Right.
something.
Well, I think with contraception, so when we talk about the side effects of contraception, so there are the medical side effects and how the woman feels physically, but there are side effects far more reaching than even that hit the relationships, hit our society, hit how the woman probably looks at herself, how the man looks at women. I mean, there's so many
Yes,
things that it's just a
yes.
ripple effect. So, it takes a lot though, because you have to educate people and, and that's what we really try to do with Crate Model and NaPro technology. There's a lot of education involved, a lot of explaining. We are very open with couples and our patients when it comes to, their bodies and all that. And it's really, I some people might say I'm biased because my dad, is the one who developed NaPro technology. You're just saying that because he's your dad. Well, yes, I mean, they'd be fair to say that, right? Like, how many times will we public say, well, my dad, is
Yeah.
wrong on all this. But actually I get to experience it every day with how I practice medicine. And I can tell you um, that it is a beautiful way to practice medicine. And there's so much good that comes out of it. And many times, not all the time, but when we take care of women with infertility, for example, many times I don't need to help them with their second or third baby. And sometimes I have to help them with every pregnancy. And then sometimes I have seen girls come to me when they're high school or college age. Now I'm old enough where they've gotten married and they had
Mm.
issues. And you know what? They are informed. They know I might have a higher chance of struggling to get pregnant. And if they don't get pregnant, they come to us really quickly. And then we just figure out what's the last
What's
steps of their
going on? Yeah.
infertility is. And to
Yeah.
help them achieve a pregnancy. And then they achieve a pregnancy. And so that infertility battle gets truncated, but they're already aware I might struggle and but they know ahead of time because we already started digging into these issues before they ever got married, which I think is
Yeah.
important too. And then their husbands are informed, get the husband involved. And we think it's very important for the husband and the wife to understand that fertility, it takes two, and I mean, God too, right? So really it
Yeah.
takes more than two. But if you think about when we deal with infertility, miscarriages, and all that, every life truly is a miracle because when everything works perfectly, we have a new life. But one or two things go off and it can be so hard. And it's amazing how many things have to happen for one life to be created. And I think it gives you a different appreciation too for
Yeah.
every child that's born.
Yeah.
So
We
it's nice.
realize what a miracle we all are, huh?
Yeah.
Huh?
Yeah.
God bless.
So it's
Hey,
really amazing.
this was such a treat. God bless you, and thank you so much again. I really appreciate your time. I mean, it was invaluable. Um, are there any resources off the top of your head,
Yeah.
Dr. Teresa, as far as finding NaPro doctors, and also if somebody wanted to investigate some of these issues, again,
Yeah.
IVF or fertility or
Great.
natural family planning?
Well, so a few websites off the top of my head. If you want to find like a Creighton Mall practitioner or a certified medical consultant, fertilitycare.org is a website that has a lot of like so you can search for a teacher by location and you can see on the website.
Fertilitycare.org, and I'll get
.org.
these in the yeah, and
Yep.
I'll get these in the show notes.
Of course, the St. Paul Six Institute website, and you can always call us if you're trying to find somebody. And then actually, if you're looking for a surgeon um, who is trained in surgical NaPro technology, there is a website with surgeons on there called SP Surgeons, SURGEONS.org. And there's a list. There aren't very many of us who are trained. There's less than 30 of us around the country who do what we do, surgically speaking, for endometriosis and
Okay.
that. But anyway, we have this postgraduate fellowship training, and that's what I'm pretty involved in teaching these young OBGYNs how to do good surgery that's protective and respectful of the reproductive organs and treats the
Mm.
condition correctly. And
So do you obviously have people then traveling from out of state
Mhm.
to come visit you, don't they? I mean, if
Yeah,
somebody's in Illinois, uh, you know, do they go to Omaha and
yeah, we've
right?
had patients from every state in the United States come to us, and we've actually had patients from other countries come to the United States. In fact, from multiple continents. I know for sure Europe, South America, and Africa, we've had patients travel to have surgery with us. We have some from Canada who come see us as
Wow.
well. Um, and so it's obviously there's a need for more of us, but those are a few good websites I think to start.
Okay.
The other thing too is we do research here at the Institute, and my dad has a summer research program. So a lot of times we have college students who need a summer job who are interested in research, and they can contact us and we can see if
Okay.
there's an opening available. But we've had a lot of summer research interns come here. So we're very interested in research because we have a lot of questions that still need to be answered. We want to continue to get better with everything, right? I mean, that's no one knows all the questions, all the answers to all the questions right now, right? But how do you
No.
learn? You gotta seek the truth, right?
Yeah,
So
you do. And you know what? And again, just to reiterate, people are realizing in general that the doctors they're going to don't always know that much. We assume because when you say that humbly, right? We're still searching for answers. People don't realize the average doctor they go to doesn't know everything either. As I start asking questions to some of these doctors, they go, Jack, we don't know. The person comes in with the pharma company representative comes in here. He's the one that's teaching me how to
yeah,
use this pill for whatever. I mean, for
yeah,
whatever cause. I'm not
yeah,
talking about fertility and stuff.
yeah,
But in general, those doctors don't know everything. They're doing the best they can, but they also get information from the CDC and other places, and
mhm,
that may not be true either. So look,
right,
we should all step back and be a little more humble and do the best we can, like you said, to bring the best we have to and as often as possible to let the body naturally help the body heal itself. I
right,
mean, that's really the
right.
underlying issue.
I like to say sometimes, we have with NaPro technology, we have patients chart their cycles. And I always say the chart doesn't lie, but sometimes we don't
Mhm.
understand what it's telling us. Like,
Yes,
and a lot of
yes.
times we do. Sometimes I can pick up a chart and I can, oh, that was a stress cycle for that patient. I can tell you. And I ask them, were you stressed this month? Like, how did you know? I'm like, well, your chart
Oh.
tells me, like, this is different for you. This is abnormal. And so we know a lot about how to interpret the charts, but there are still things I think that chart is telling us that we're still trying to figure out how do we answer that? How do we figure out why is that there? But yeah, we have to be open, and that's actually science. The whole point really of science is to ask questions. That's from the very beginning, the scientific method. You have to propose a question and how you're going to answer it. You might be wrong and you might be right. And
Hmm.
none of us are right 100% of the time. Except my dad when I do the opposite of what he tells me. I hope he doesn't watch this because he won't let me forget that I said that.
No, he's gonna watch. We're gonna make him watch it,
Yeah.
Dr. Teresa. Hey, God bless you. Thank you so much.
Yeah.
Thanks again, and thanks for the information. And we'll get this out to you. It's probably gonna just so you know. In fact, I'm gonna stop recording, and I'll just tell you in just a second. And thanks to everybody that's joining us on the program today. I'll have everything that Dr. Teresa just outlined as far as these websites and things in the show notes. And then I'll probably poke around and maybe even add the podcast that we did previously with Dr. Hilgers. You can get even more information. Those are great podcasts. They never go out of tune. Because we're talking about truths that don't go away.
Okay.
So
Okay.
all right. Hey, God bless you. Thanks everybody.